We've got 40 to 50 million doses already made. We're producing more every week. And once we get the regulatory approvals in a few days, I would say, then it'll be down to the government to decide how much they can take, how fast they can take it. And we're talking about, reaching at least 300 million doses by July 2021. But initially, in the first 1 or 2 months, that offtake will be slow. And once the logistics and everything works out well, you know, the rollout we can expect in January for Covishield. So all the data has been submitted, as you know, to the UK and to India. We must respect the process that the eminent regulators and learned regulators are evaluating all the data, because nobody wants to compromise on safety and efficacy. This is exactly to answer your point. A lot of people keep raising issues that, oh, are we rushing through vaccine development and other things? But now we're asking the reverse question, that why are we not approved? So I think we must give a few more days, and there are no concerns at all. In fact, you'll be hearing some good news from the UK very soon. You've heard that from the CEO of AstraZeneca. It's a 90 to 95% effective vaccine. If we just keep a 2 to 3 month gap between dose 1 and dose 2, they will make that very public with documentation. So we'll wait for that. In the meanwhile, the emergency use licensure should come by the end of December or early January in the UK. And, simultaneously then we hope to get that in India. There's a lot of data that has come from all these global multi-centric trials. He's not just evaluating the Indian trial data, he's looking at South Africa, UK, everywhere else. We should just wait for some good news in the new year, which will come. As I said, we can expect our vaccine to be launched in Jan 2022, because we're starting the phase 1 trials in the UK with Codagenics, which is one of them. India is part of COVAX. And what we have always said is that we'll keep giving 50% of everything we make to India and to COVAX at the same time. So, if we're producing 60, 70 million doses every month, there'll be plenty of vaccines to go around both to India and to COVAX countries. And we're trying to, as soon as possible, give as much as we can equitably to all the nations, including India. And of course, initially for the first month, we may give most of the volumes to India, because don't forget, to export to these countries, we have to go through the WHO pre-qualification procedure as well, which may take another month or so after it's licensed in India. So that way, India will have, priority because of that as well. And because India is such a large population, we will probably end up giving the majority of those 50 million doses to India first. Maybe if the other countries are ready to take a few million doses, we will. But every month, as I said, we're churning out more than 50, 60 million doses. And, that's going to reach 100 million doses every month by March, because that's when we're going to commission the third facility that we have identified and is getting ready. So that's the plan, and everybody is eventually going to get it. Some countries and some people will have to wait a little bit longer than others, but we're just trying the best we can given the situation. And the first 6 months of 2021 is definitely going to be a situation where there's a shortage globally. Nobody can help that, but we'll see that easing off by August, September, because you'll have other vaccine manufacturers also being able to supply.